The healthcare industry in the United States has grown into a massive corporate enterprise, often overshadowing its original mission of providing compassionate, human-centered care. This shift has brought both opportunities and challenges that we'll explore throughout this presentation. United Health Group reported total net earnings of about $12.1 billion for 2025, which is a significant figure in the healthcare sector. At the same time, Aetna, under CVS Health, contributed around $5.2 billion in adjusted operating income, highlighting its strong performance within the larger company. Cigna also posted impressive numbers, with a net income of $6 billion and an adjusted operating income of $8 billion. These figures really underscore the financial strength and market presence of these major healthcare players. Before we go any further, it's crucial to know your rights when it comes to emergency medical care. Do not wait if you need emergency treatment. The Emergency Medical Treatment and Labor Act, or EMTLA, guarantees that every U.S. citizen has the right to receive emergency care regardless of their ability to pay. However, keep in mind that EMTLA only applies to hospitals. It does not cover urgent care centers or visits to a physician's office. Here's a smart tip: all hospitals provide financial assistance, including options that can reduce your hospital bills to zero. Once you are stable, make sure to ask for a patient advocate, not just anyone in the financial department, to help you with this process. So, what can you do when your insurance won't approve your testing or prescriptions? First, it's crucial to know your rights. Understand what your insurance plan covers and the appeal process available to you. Next, know the players involved. This means identifying the key contacts like your doctor, insurance representative, and possibly patient advocates who can help navigate the system. Then, take control by staying organized and persistent in following up on your case. Finally, take action. Don't hesitate to file an appeal, seek a second opinion, or use external resources to get the care you need. You have options, and you're not alone in this. When speaking with over 50 healthcare professionals, from insurance verification specialists to physicians, a clear and consistent message stood out. They all wished that patients had a better understanding of their own health insurance coverage and benefits. This gap in knowledge creates challenges because many patients aren't familiar with the specifics of their plans. As a result, when medical issues come up and financial conversations happen, healthcare staff often end up feeling unfairly blamed, even though they have no control over insurance rules, coverage limits, or costs. This highlights just how important it is for patients to become more educated about their insurance to improve communication and reduce frustration on all sides. It's a key step towards smoother healthcare experiences. When we talk about understanding your individual health insurance coverage, it's important to know that most plans include deductibles and co-insurance costs that you, as the member, need to pay before the insurance starts covering medical expenses. Beyond that, nearly all health insurance plans have benefit exclusions and specific coverage criteria, along with various limitations. All these details are given to you at the time you enroll, and in the insurance world, we call these your member benefits. Insurance companies provide a lot of documentation that explains what's covered, what's not, and what your financial responsibilities are. However, these materials can often be overwhelming and tough to fully understand or remember over time. Let's go over some common financial terms that are important to understand when dealing with insurance. First, your premium is the monthly payment you make to keep your coverage active. Then there's the deductible, which is the amount you have to pay out of pocket before your insurance starts to share the costs. After that, you have the copay, a fixed fee you pay each time you access a covered service, like visiting the doctor. Co-insurance kicks in once you've met your deductible. It's the percentage of costs you're responsible for, like 20%. And finally, the out-of-pocket maximum is the highest amount you'll have to pay in a year for covered services, after which insurance covers everything else. When reviewing your benefits, it's important to break them down into key sections to really understand what you're covered for. First, take a close look at your essential health benefits like preventive care, hospitalization, and mental health services. Make sure your plan covers these and be clear on what your out-of-pocket costs will be. Keep in mind, many insurance plans have recently increased patient costs, so knowing what you pay is crucial. Next, check if your current doctors and facilities are in-network, because your benefits and costs can vary a lot depending on whether your care is in-network or out-of-network. Finally, be sure you know all the exclusions and limitations in your policy. Many insurers limit coverage on common but expensive medical tests, so understanding these details helps you avoid surprises. Overall, the key is to really know your coverage inside and out. Now, it's really important that you and everyone on your health insurance plan understand the key details of your coverage. You need to know exactly what your plan covers, your deductible and when you have to pay it, your co-insurance and its timing, and also your copay and when that applies. Knowing these answers gives you a clear picture of your financial responsibilities. Once you have a solid grasp of these benefits, we can dive into how to maximize your coverage, what steps to take if a claim is denied, and how to handle urgent medical needs when costs are a concern. We'll cover that last part in detail in our next presentation. To get the most out of your healthcare insurance coverage, it's important to take full advantage of your preventative care benefits. Many health plans offer these benefits with no out-of-pocket costs, so don't hesitate to use them. Also, keep in mind that most deductibles reset annually. Scheduling higher-cost tests and procedures early in the year means you can meet your deductibles sooner, which then allows your insurance to cover additional medical services at a higher rate, often up to 100%, for the rest of the year. This strategy can really help you manage your healthcare expenses more effectively. Did your insurance deny coverage for a medical procedure, test, or prescription? It's important to know that even if your provider submits an appeal for you, the insurance company might still uphold their denial. So, here's what you do: step in and take control. First, write your own appeal letter. In this letter, focus on how not getting this care will affect your quality of life, describe your suffering and the impact on your daily routine in detail. Make it clear what the insurance is really denying you. This is key because to them, you might just be a member ID number, but your letter should put a real name and real impact behind that decision. Also, include everything you've done so far to manage your condition, any medications, self-care, or treatments prescribed by your doctor. Be sure to get copies of all your medical records from every physician involved and submit them with your appeal. Send your appeal through certified mail or via your insurance's patient portal, and always confirm they received it, especially if submitting online. Remember, under the Affordable Care Act, standard appeals must be decided within 30 days, and urgent appeals, those that could seriously jeopardize your health, must be resolved within 72 hours. If your situation is urgent, make sure to mark your appeal as such when submitting it. Taking these steps gives you a stronger chance to get the coverage you need. When patients appeal a denied claim or service, they have a significantly higher chance of success compared to those who just accept the denial. In fact, for many, especially Medicare Advantage members or those with strong medical evidence, the chances of having a denial overturned often exceed 50%. The appeals process might seem complicated at first, but it really doesn't have to be. Many people don't file appeals simply because they're unsure where to start or what to say. It's also critical to remember that appeals must be submitted within certain time frames, so acting quickly and keeping thorough documentation is essential. Ultimately, it's about taking control of your health and your insurance benefits, being more than just a member ID number. Before we wrap up, I want to give you a preview of our next presentation. We'll be sharing some really valuable pro tips on what to do if you find yourself unable to pay your out-of-pocket costs up front for a test or procedure you need. It's all about empowering you with strategies to manage those expenses effectively. Remember, the key message here is to always take control of your health and your healthcare. Being informed and proactive makes all the difference. Stay tuned for these important insights.